This is a patient with standard nasal anatomy illustrating a very typical case of cryotreatment. What we are seeing here is some of the critical structures of the middle meatus. What you can see with the gentle medialization of the middle turbinate is the critical anatomy where we would target the cryotreatment. Where the middle turbinate tail inserts onto the lateral nasal wall, right at this junction here, this is a good approximation of the sphenopalatine foramen, the origin of the parasympathetic innervation to the nasal cavity. The target zone of cryotreatment would be around this area here. If you place the device too anteriorly, you're going to end up freezing the fontanelle of the maxillary sinus, which is obviously not going to be therapeutic. The key here is to place the balloon as close to the end of this cul-de-sac as possible, so that it has contact in this critical zone here. You are also going to get freezing on the medial side of the balloon, so you will get some freezing on the lateral surface of the middle turbinate. The main goal is to treat this target area right at the insertion of the middle turbinate to the lateral nasal wall. Note the relationship of the target area for cryotherapy relative to other structures of the middle meatus. We are well below the uncinate process and the bulla ethmoidalis. The balloon is going to sit inferior to all of those structures, which is not an area we are typically used to working in with traditional sinus surgery. It does take a little bit of an adjustment to get used to placing the balloon more inferiorly and posteriorly in the middle meatus than we normally might if we were to do endoscopic sinus surgery. Now, the balloon is going to be carefully placed atraumatically into that spot. Notice that the surgeon is placing it at the very posterior and inferior aspect of the middle meatus, probably using both a visual and a tactile feedback to know that it is the right spot. Once it is placed, of course we want to keep the balloon perfectly still, and you will see the freezing as is expected. We are going to leave the balloon in place for 30 seconds. After the end of 30 seconds, we are going to have the patient breathe through their nose. This allows warm exhaled air to facilitate the defrosting of the balloon. We should only try and remove the balloon when it's fully defrosted and requires only minimal effort to slide it off the surface. Otherwise, we can cause trauma to the mucosa. As you can see, the surgeon has been very successful at achieving that target zone of cryotreatment in the posterior inferior aspect of the middle meatus, right at the insertion of the middle turbinate to the lateral nasal wall. Again, you can see the zone of cryotreatment relative to the more familiar structures of the middle meatus, the uncinate process, and the bulla ethmoidalis behind the uncinate. Again, note how inferior and more posterior we are relative to the other structures of the middle meatus.